let's talk about something we all do, something we never even think about, breathing. But what happens when that automatic, essential function suddenly goes wrong? We're diving into a critical medical emergency called acute respiratory failure. Every second counts, so let's break down what it is and why understanding it is so incredibly important.
So, here's how we're going to tackle this. First, we'll get a handle on what this failure actually is. Then, we'll explore the two main types of trouble you can run into. After that, we'll learn how to spot the body's warning signs, see how doctors play detective to diagnose it, walk through the emergency response plan, and wrap up with the best part, how to help prevent it.
All right, let's start with a big question, right? What really happens when that one thing we can't live without for more than a few minutes, breathing, just stops working the way it should?
I mean, just stop and think about that. 20,000 times every single day. Your body just does it perfectly. It's a miracle we completely take for granted. So what happens when that reliable, automatic system suddenly breaks down? The consequences are fast and they are serious.
And this is the official name for that breakdown: acute respiratory failure, or ARF. This is way more than just feeling a little winded. It's a full-blown, life-threatening crisis where the lungs are failing at one or maybe even both of their essential jobs: getting the good stuff, oxygen, in, and getting the bad stuff, carbon dioxide, out.
And you know, this isn't some vague feeling or a guess. It's a medical diagnosis based on cold, hard numbers. Doctors can literally measure this crisis in your blood. They're looking for one of two things: a dangerous drop in oxygen, which is called hypoxemia, or a toxic buildup of carbon dioxide, known as hypercapnia.
Okay, so now that we know what it is, you might think respiratory failure is just one thing, but it's not quite that simple. It turns out there are actually two main ways the whole system can get into serious trouble.
Think of it like this. You've got type 1, which is basically an oxygen problem. The air is getting into the lungs, but for some reason, the oxygen can't make the jump into the bloodstream. Then you've got type 2, the CO2 problem. This is more of a mechanical issue. The body physically can't exhale effectively enough to get rid of the carbon dioxide waste.
So when we look at what causes that type 1 oxygen problem, you start to see a pattern. These are all conditions that directly damage the lung tissue itself. Imagine pneumonia, filling your tiny air sacs with fluid. There's just no way for oxygen to get through that gunk. Or a pulmonary embolism, which is a blood clot in the lungs. It's like a roadblock on the highway, so the blood can't even get there to pick up the oxygen. The problem is right at the source.
Now, type 2 is a totally different beast. The causes here are often about the machinery of breathing. An opioid overdose, for instance, can basically tell the brain's control center to just stop sending the signal to breathe. Or diseases that weaken the muscles mean the pump, your diaphragm and chest muscles, just isn't strong enough to move air in and out. It's a failure of the engine, not just the filter.
So when things are going this wrong, your body doesn't just suffer in silence. It starts sending out SOS signals, big time. Let's talk about how to read those signs, the clues that tell you a crisis is building.
At first, the signs can be kind of subtle. A person might just seem a little anxious, maybe fidgety. But what's really happening is their body has hit the panic button. They start breathing faster, their heart is racing. It's desperately trying to compensate, to whip what little oxygen it's getting around the body as fast as it can.
But that frantic compensation can't last. If the problem isn't fixed, the body starts to lose the fight. And that's when you see the true danger signs. Cyanosis, that bluish tint to the skin and lips, means there's a severe lack of oxygen. The brain starts to get confused as it's being starved. At this point, the body isn't compensating anymore, it's shutting down.
The second a patient shows up with these signs, it's all hands on deck. The medical team instantly becomes a squad of detectives, and their only mission is to figure out what's wrong and figure it out fast. And they have a clear playbook. The absolute gold standard test is an arterial blood gas, or ABG. It gives them the precise, undeniable numbers. Now before that, they'll usually get a quick snapshot with a pulse oximeter, that little clip they put on your finger. And then a chest x-ray lets them literally look inside to find the culprit. Is it an infection? Is it fluid? What's causing all this chaos?
And when they get that ABG result, this is one of the magic numbers. If the level of oxygen in the arteries, the PaO₂, drops below 60, that's it. That's the confirmation of a severe oxygenation problem. That is type 1 respiratory failure.
And on the flip side, for the carbon dioxide problem, this is the number that matters. If the CO2 level, the PaCO₂, creeps up over 50, that tells them the body's ventilation system is failing. It can't clear its own waste. It's amazing how it all comes down to these specific,
data-driven points.
So the diagnosis is confirmed. The clock is ticking. But this isn't a time for panic. This is where training and systems take over. It's a calm, methodical, and incredibly effective plan to restore the most basic function of life.
It all comes down to the ABCs, the absolute foundation of emergency medicine. First, A for airway. Is the path open? Can air even get in? If not, fix that first. Then B for breathing. Get oxygen into them, and if necessary, help their body breathe. Finally, C for circulation. Make sure the heart is pumping effectively to move that oxygen around the body.
And that B for breathing comes with a whole range of tools. It can start simple with a nasal cannula giving a little oxygen boost. From there, it can scale up to different face masks, to non-invasive machines like a BiPAP that help push air in, all the way to, in the most critical cases, a mechanical ventilator that completely takes over the work of breathing.
But look, supporting the ABCs is only half the battle. You have to attack the root cause, so at the same time, treatments are targeted at the underlying problem. If pneumonia is the culprit, they're starting powerful antibiotics. If it's a severe asthma attack, they're using bronchodilators to force the airways open. You have to fix the original problem to win the war.
Okay, we've gone through some pretty intense stuff. So let's shift gears to the most hopeful and empowering part of this whole story: prevention. What can we actually do to protect our respiratory health so we never end up in this situation?
And the great news is the strategies are powerful and pretty straightforward. The single biggest, most impactful thing anyone can do is stop smoking. It's a total game changer for your lungs. Beyond that, simple things like getting your annual flu shot and the pneumonia vaccine can prevent the very infections that often lead to ARF. It's all about being proactive.
And that's really what it all comes down to. We've seen how fragile this system can be, but we also have so much power to protect it. Breathing is life, plain and simple. So the final question I want to leave you with is this: what is one step, big or small, that you can take today to protect yours?